So the first substantive area of the blueprint focuses on current employment services. And really what we're talking about is supported employment services. The kind of services that a person receives vary greatly depending on their disability, depending on the agency that they receive services from, and often where they live in the state. Supported employment provides personalized supports for people with significant disabilities to find and keep a job. And what's important is that these services have been proven to work. Most often, it involves a job coach accompanying someone to employment to help them with that employment. In Illinois, of those who are receiving vocational rehabilitation services, only 4.3% of people with disabilities have supported employment as a goal. And that means that they're probably not receiving supported employment services, they're receiving other services, or their cases are closed with another goal, such as employment. The other thing is that services are usually limited to 18 months. Federal money and state money combine to provide these services, and the federal money essentially stops after 18 months. And therefore, the services usually stop after 18 months. What are the barriers to supported employment use? And we wanted to examine why aren't they being utilized more? The bottom line is that there is great variance among vocational rehabilitation counselors and offices in terms of wanting to open or being willing to open a supported employment case. Often there are many reasons for this, but one of the reasons is a presumption about the employability of the person who's trying to receive the service. There's a perception that supported employment services are reserved for those who are high functioning or already have a job lined up. The supported employment services are available under certain waiver programs in Illinois, including the Adults with Developmental Disabilities waiver and the brain injury waiver after 18 months when the federal money runs out. Unfortunately, the transition between funding service sources is extremely difficult and often not timely. And so what often happens is that people are not transitioned between one funding source and the other at all. There is a model operating in Illinois, and it's been operating since 2005 through the Division of Mental Health that provides supported employment services for people with serious mental illness, and this is known as individualized placement and support. It's a national model developed by Dartmouth, and it's worked really, really well in Illinois. One of the core concepts of IPS, as it's known, is that it makes employment services a core part of the person's mental health treatment plan. And this is really important because a person doesn't have to be screened or decided by someone else that they're ready for employment. The concept is that you really meet the person where they are. And that's why it's really worked really well in Illinois. And it has been successful. The issue is that there are just simply not enough providers providing the service. And at sites that are providing the service, they're limited to how many people they can serve. So IPS fidelity requires that a caseworker who's providing employment services only serve 20 people at a time, which means in most places there's only one employment specialist, so you're only serving 20 people, which greatly limits the availability of the service. In the blueprint, we have various recommendations for current employment services and how to reform them to be in line with Employment First. The first is to revamp supported employment programs to encourage use by vocational rehabilitation counselors. And really, training is key here. Encouraging a vocational rehabilitation counselor to use the service, doing intra-agency services for those who have done it well and who do use the service could be a really cost-effective way. And also involving service providers who have done really well at providing supported employment services. The other thing is to extend supported employment services beyond 18 months. A new federal law actually extends the federal money for supported employment services to 24 months, which should significantly help. But state funding could also kick in after that 18-month or 24-month time period to help people stay employed for the length of their employment and not have an arbitrary deadline as it is. The Division of Rehabilitation Services and the Division of Developmental Disability should work together to ease the transition between funding sources as well as other waiver programs such as the brain injury program. We really should be data sharing as well as training staff on how to make these transitions work. And finally, expanding the number of people with mental illness served through the individualized placement and support model would help. I now want to talk about supported employment funding and rates. I don't think it's a surprise to know that these services are underfunded. Not only is there just not enough money to provide the number of people that we would like to provide services to, but also because the rates are not high enough. What ends up happening is those who need significant support and need a lot of support are not able to access this service. There is also a difference between the rates paid by the Division of Rehabilitation Services and the Division of Developmental Disabilities for supported employments under the waiver program. And so the Division of Developmental Disability rates are essentially 1/3 of the rates paid by DRS. This serves as a disincentive for transitioning between funding services, as we just mentioned, after 18 months, but it also serves as a disincentive for a person who has been denied services by the Division of Rehabilitation Services to receive services through the DD system, which creates a significant barrier, and essentially people with developmental disabilities are not receiving the supported employment services. So the recommendations for supported employment funding and rates are relatively simple: to increase the funding and rates. And what we really want to do is offer incentives for providing integrated employment. Adjusting the rates to reflect the actual cost of services would be key here. And there are studies out there that have some data about what it costs to support someone with a significant disability in a supported employment setting. The other thing is to make the rates consistent between DRS and DDD. And I just want to point out that this disparity has been pointed out repeatedly, and it's certainly not a new recommendation, but it is out there, and it would help significantly. Moving to data collection and reporting, Illinois lacks an effective system to collect and publicize data on the employment of people with disabilities. It's very difficult to get information on where people with disabilities are spending their days and how many are served in integrated settings and have jobs. The other thing that's going on is that information is not shared among state agencies that provide disability services or even employment services, even between the Division of Developmental Disability and the Division of Rehab Services. They're not sharing data about who's being served where and who's working where or not working. This makes it difficult to understand the scope of the problem that we're facing in terms of employment first services and making us an employment first state, but it also makes it difficult to gain support for services that work, particularly for gaining support for increased funding without knowing where we've had success and being able to point out how many people we've increased in employment. It makes it very difficult to make a case to the legislature or other funding sources or other supporters for these services. The recommendations for data collection are to develop a comprehensive data collection system to track and report employment data on a timely basis. And I think that timely basis is something we want to recognize, and we want to point out that in other states, employment data is reported monthly, which is a key component of having a successful employment first policy program. One of the ways that the divisions could do this is requiring service providers, by writing it into contracts, to report data on where people are being served. Requiring state agencies to share employment data so we can track people and show successes, and reporting data to the public regularly. And this has to be in a user-friendly way, but again, this provides both accountability for programs, but also helps to gain support for programs that are working.